Arteriosclerosis is a disease when the blood vessels which supply oxygen and nutrients becomes thick and stiff. Normally the blood vessels are flexible and elastic, but because of this cholesterol and other accumulations it becomes thick and stiff and cannot supply proper oxygen and nutrients. And what is atherosclerosis? Atherosclerosis you know very well. It mainly occurs due to atheromatous plaque. Because of atheromatous plaque, because of this cholesterol and other matter obstruction at the coronary artery, it leads to atherosclerosis. Then what is the epidemiology of this arteriosclerosis? Mainly it affects the American population. Mostly the Americans are mainly affected due to this atherosclerosis or arteriosclerosis compared to other country people. And when it comes to etiology of atherosclerosis, it mainly affects along with increase of age, and men will be more affected, and it may comes with hereditary from forefathers, and if the high lipid levels and high cholesterol levels which may lead to this atherosclerosis or arteriosclerosis. Smoking is also another factor for this. And then when it comes to symptoms, mainly chest pain will be there, and pain at the leg and arms will be there depending on the blockage of artery. And if the artery towards the brain is blocked, then it may result in confusions to the patient. And if the arteries towards the legs and hands are blocked, then it leads in muscle weakness. And then when it comes to test and diagnosis, mainly blood test, Doppler ultrasound test, ankle test and angiogram test, and commonly electrocardiogram test are performed. Then the non-pharmacological treatment for this includes, the main thing is increased physical activity, weight reduction and diet modification common. And pharmacological treatment is somewhat different. Here what we have to do is we have to reduce the low density lipoproteins. So low density lipoprotein therapy is initiated with the statins. So statins are the drugs which have to be given for this treatment for at least 6 weeks. If there is no recovery after 6 weeks, then what we have to do is, then again intensive lipid lowering treatment should be started with increased dose of statins. And also sequestrants or nicotinic acid should also be given to these patients, and again you have to watch for 6 weeks. If there is no recovery again, then in the third step, then what the doctors will do in this third step is they will continue this intensive lipid lowering treatment. Along with that, with a lipid specialist, they will perform other things. And if then the goal was reached, then in the fourth step the responses are monitored and patient is discharged. This is the treatment which is done for this atherosclerosis or arteriosclerosis disease.